Hello and welcome to the Daily Briefing for Monday, September 21st, here on KLAM and KCDV, or if you consume our briefings online at youtube.com/Cordova TV, just as good. We're going to start the week speaking to the doctor, Dr. Sanders. Not so much about COVID, as our dashboard continues to look excellent with 0 active cases, but more about the coming of the flu season and things that we need to be aware of dealing with two sort of significant health events going on at once. You may have been hearing some talk about that on national or state media. We're going to get a local impression of it for you here in our briefings, which are in the 1, 5, and 8 p.m. hours on the radio and uploaded to youtube.com/Cordova TV. So, prepare to hear from the doctor here on today's Daily Briefing. Doctor, welcome to the beginning of the new week. As I survey the box score, I see lots of zeros where zeros should be, so that's got to continue to feel pretty good given all the work that you and everyone has done over these months in getting out the prevention information.
Absolutely. We are glad to be back to that 0 active cases of COVID in Cordova.
Of course, it doesn't mean it isn't here, right? It just means there isn't any detected.
Exactly.
All right.
One of the things that we've seen nationwide is that communities and areas where mask wearing, social distancing, frequent hand washing, we're seeing a lot of asymptomatic or low symptomatic cases. And so certainly we have reason to believe here that that's the case. And so we want everybody to continue those excellent behaviors.
All right. Well, fortunately, we don't have to spend a lot of time on the specifics of that, but we are now moving into the early fringe of flu season. The peak of that, I guess, is typically December to February, at least in the lower 48. Maybe you can elaborate on if it's different up here, but the beginning of the vaccination season at least is underway, and Cordova's now ready to participate in that. Is that right?
Yes. So it's an important year to get your flu vaccine, both to protect hospitals from being overwhelmed with dealing with respiratory illness, but also to protect individuals. We have flu vaccine available here in Cordova. We have not yet received our high-dose flu. The high-dose vaccine is the vaccine that we give to individuals older than 65. So we do recommend anybody over 65 to wait until we get that specific vaccine available for them. We have the normal flu vaccine here. We are going to have a flu vaccination clinic in the ambulance bay on Tuesday, that's tomorrow, from 1 to 2 p.m., and again the same time Friday from 1 to 2 p.m. For anybody that is 18 or under, the vaccine is free. If you're 19 or older, it will be billed to insurance, but there will not be an out-of-pocket cost. So similar to what we have done with with the testing, we will be collecting insurance, but we are not going to be billing any out-of-pocket costs for the flu vaccine. We want everybody to come Tuesday or Friday from 1 to 2 p.m. and bring their insurance card and ID card and get their flu vaccine. Okay,
and of course, we have to emphasize, in case there's anybody that could be confused, that flu vaccine doesn't do anything for COVID. They're different problems or different diseases. There has been some talk, and it's a little hard, of course, to filter out what is media hype and what is actual reality. But, we're hearing words like twindemic, having of these two things at once. From your seat, what are some of the concerns of having, a regular flu season along with a novel virus pandemic?
Well, the concern is that on a typical flu season, or really in the winter when we see more viruses circulating, including flu, our hospitals operate at near capacity. So on a typical year, you will see hospitals having small periods of time where they are full and have very few beds. Very important this year to protect that hospital capacity and the bed capacity. So so that we are able to manage the people that develop COVID-19 and require hospitalization. So that's really the concern, is to ensure that we're protecting that hospital capacity.
Right.
I do think that there's also some data from Australia that shows that with social distancing, wearing masks, and frequent hand hygiene, we are not seeing as bad a flu season historically see. So there's a little reassurance there, but it is something we want everybody to take seriously this year, and we want to do as much prevention as we possibly can. We want everyone to come and get their flu shot as soon as we have the high-dose flu vaccine available for any individuals over 65 years old. We will put out information similar to today and have vaccination clinics for those members of our community that are over 65.
Okay. Well, and you touched on what I was going to mention next. There actually the presence of the COVID pandemic and the mitigation measures that everybody's taking, with washing hands, wearing masks, staying apart, actually has the potential to make the flu season somewhat less severe. But at the same time, you don't want that to make people think, oh, well, since everybody's doing this preventative stuff, I don't have to get the vaccine. So, I mean, is there the potential, or is it just speculation, that the mitigation efforts we use for COVID could be helpful in reducing transmission of influenza?
I do believe that it will be helpful. Again, this is an unprecedented year, so we're hopeful that that really does mitigate flu and that our hospitals remain with the capacity that they have. But we do want everybody to continue to support any prevention effort we can so that we can maintain our hospital capacity and maintain our activities and schools getting back to normal as best we can. I think that we're doing very well here in Cordova, and we just need to continue on that path.
Right. So, in other words, again, what I'm hearing from you and what I've been hearing from doctors all the way up to the federal level is, while we may benefit some, we may get some tangential benefit from all of the masking and everything in terms of less flu spread, that's not a substitute for a vaccination, and people should not think, well, I guess I don't need to do that because everybody's wearing masks, in other words.
Exactly. Exactly. We just need to maintain the ability for our healthcare system to be able to respond to anything that comes our way. So I think all the preventive measures that we can take will help keep the healthcare system intact and keep everybody getting back to the best normal operations that we can.
Anything new on focusing back on COVID? Have you being a physician and getting exposure to journals or conferences or newsletters or emails or whatever? How is the medical community doing on towards its progress of either a vaccine or effective therapeutics for COVID?
I think that the science is working in a really unprecedented manner with using technology and even some artificial intelligence to crunch data and look at treatments and vaccines. I think that this will hopefully happen faster than it historically ever has, but I couldn't quote any time right now of when I think that will happen. Other developments of it, I know the CDC continues to monitor very closely to look at a whole range of both short and long-term effects of COVID, and they are continuing to learn more about the concerns of other organ damage outside of lungs, very specifically looking at some heart issues that seem to come along with COVID. So for many people, this is a mild illness, but it is certainly not something to be taken lightly, as we just don't fully understand the effects of it this time.
Yeah, it's been hard for me to get much of a sense of the long haulers, as they've been referred to. If the presence of those folks, of course, they seem very prominent because every time you discover one, all of the big national media, regardless of their slant, draw attention to it. Which leaves the layperson wondering, is this really? So how would you assess, say, the percentage of people based on what you've seen, based on data, end up having long-term issues, or is that not something you've really been able to study well enough?
I don't think that we have enough information, especially when you're looking at long haulers, as they say, to say how long would they have problems or have these risks. But that you bring up a very important point. A very small number of people are developing some of these severe complications, but it makes big news because COVID is such big news. So we don't want people, we're not trying to make people fear what's going on and be more fearful of COVID. We just want everybody practicing and exercising that extra bit of caution because of the unknown, which, of course, the media highlights every complication. And if we were highlighting every complication of every illness that we deal with, a lot of things could feel scary. So definitely talk to your healthcare providers if you have questions or concerns. We want people feeling comfortable still doing their normal daily activities, going out to do errands, exercising, and just really continuing to take good care of our own individual health that puts your body in the position to be able to manage a viral illness much better when you're taking care of yourself.
Would you say, and again, if this is not any time, that it's not a good thing to wing it on, if you haven't had a chance to look over enough papers or something like that. But I've been curious, would the discovery and announcement of a really good therapeutic be as big a deal as the announcement of a successful vaccine, or are they really on the same plane, or would it really make that much difference one way or the other?
Oh, I just think it depends on, it would really depend on the success of the therapeutic and how well it worked, right? And how quickly we could get everyone access to it. Certainly if we came up with a treatment that worked as well as, say, penicillin for strep throat, that would be a phenomenal discovery. But we'll wait and see what happens. Is
that the kind of thing, kind of like working on a vaccine, that would really take a lot of time to be able to know how effective it was?
Vaccine will work a little different, and the vaccine effectiveness will likely be, it's different than finding a therapeutic that definitively works for something. So I might have thought of that. We'll just have to wait and see.
Okay. Well, it's just nice to have something to keep your fingers crossed about, and I'm encouraged by hearing you continuing to perceive that there are a lot of minds hard at work in even artificial minds in some cases, like you said, working on this and trying to figure out an unprecedented solution to an unprecedented, at least in the modern era, an unprecedented situation that we're facing here. Anything else in conclusion, or did we pretty well cover it?
The one other thing is we no longer have the testing occurring at the airport. We're asking people when they travel to come into either Elanco or the hospital for the testing, for screening or testing times. At Elanco, it's Monday, Friday, and Saturday. Well, Monday, Friday from 2 p.m. to 3 p.m., Saturday from noon to 1 p.m. At the hospital, it's Tuesday, Wednesday, Thursday from 9 a.m. to 9:30. So we have 6-day-a-week testing available, and if there are any questions or concerns, people can call either the hospital or Elanco Clinic.
Okay, well, sounds good. Thank you for helping us start the week with good information, and we will speak to you whenever the spirit moves next.
Thank you.
All right. Our thanks once again to Dr. Sanders, and a big thanks again not only to her for her participation in this program and the hard work that she's done as part of the incident management team, but all of our doctors, our nurses, our medical specialists, who have all been part of why we continue to have those zeros on the local box score. We don't mention the other doctors as much simply because we don't get to talk to them as much. But we've got a lot of very knowledgeable and skilled people who have been working together to give us the best medical information in order to keep Cordova safe. And that, of course, is, again, being borne out with only 19 total cases. It's either 10 resident and 9 non-resident or the reverse of that, but none of them are active right now. So, again, we need to continue to be careful and follow that good advice from our medical professionals and hopefully be able to keep those zeros right where they belong. And most importantly, of course, 0 hospitalizations for anybody associated with Cordova and 0 fatalities. It's just the way you want to see it turn out. COVID-19.cityofcordova.net is the official website for the city's response. You've got information on all the different assets available, including the 2 phone numbers, 424-INFO with the city, 424-WELL from Elanca Clinic, our briefings in the 1, 5, and 8 p.m. hours on the radio, and then posted online at youtube.com/Cordova TV. Thank you for listening. We'll get back to regular programming now.